Okay, hello everyone. My name is Liz. I'm a student ambassador at the University of Houston, majoring in psychology, and I'm graduating in the class of 2021. Go Cougs. Go ahead, Greg.
Okay, so I'm Dr. Gregory Spillers. I am the director of the PreHealth Advising Center, which is actually a new office here on campus at the University of Houston. Before January of this year, we didn't have formal advising for students interested in healthcare careers, but now we do. And so what I'm going to go through is some fairly straightforward slides just to kind of outline the mission of our office and some recommendations for students who are thinking about coming to the University of Houston and maybe interested in going on to a healthcare career. So we can jump right into it. Maybe I'm having issues. Can you see the slides change?
No, it just says PreHealth Advising Center and then your name.
There we go. Okay. So again, our mission is to assist any University of Houston students that are interested in healthcare careers, and this runs the whole gamut of healthcare. So if you're interested in going to medical school, dental school, optometry school, if you're thinking about nursing, a career in pharmacy, or even allied health, physician assistant, physical therapy, occupational therapy, we're here to help you. We do offer guidance on these various healthcare career paths, including admission requirements, what it takes to be competitive and get into these programs after graduation, as well as the actual application process and the overall timeline. So when do you apply to medical school, and when can you expect needing to take the MCAT or any other test you need to get in to the program of your choice. And importantly, we're a supplemental resource office, so we're not going to replace your major advisor. So if you come to the University of Houston and you're majoring in biology or English or chemistry, we aren't going to replace the advisors within that major. You're still going to meet with them every semester to talk about your graduation requirements, what you need to graduate from UH. We help you connect the dots for what you're going to do after graduation. And so every semester when you meet with your major advisor, you'll talk about what you need for the next semester, and then you can make an appointment with us and we can get in there and really work on the details of the healthcare path that you've chosen specifically. So again, we're supplemental. You don't ever have to meet with us. And of course, you could still go into a healthcare career, but we hope that you'll utilize our office because we are very ready to help you. So this is our website. We're very excited about our website. We've put a lot of work into it. There's a lot of comprehensive information included. And it's www.uh.edu/pre-health. If you just Google PreHealth, this will be the first thing that pops up. And on this page, we have in-depth information about each of these career paths. Again, preparation and application process, instructions on how to make an appointment with our office. We have a PreHealth mailing list, which is the primary way we communicate information from our office. So any students that join our email list will get emails from us that we send, weekly. We also have a list of PreHealth student organizations that you may be interested in joining once you're on campus, and we have an event calendar. So student organizations, upcoming events, meetings, we include all of those on the event calendar. We also promote them through our mailing list as well. So when can you meet with a PreHealth advisor? We get this question a lot from prospective students. Formal advising appointments are restricted to current UH students. So if you're not physically enrolled at UH yet, you can't meet with us for a formal advising appointment. Instead, what I recommend for incoming or prospective students is, again, use our website. There's a lot of good information on there. And then shoot us emails. We're happy to answer any questions you have by email, just prehealth@uh.edu, and I'll have that in another slide later on so you can write it down. But again, we can't meet with you for a formal appointment till you're actually on campus and technically paying student fees. But we're more than happy to answer any questions you send through email after you looked at the website and thought about, okay, this is what I want to do. But I do want to send a little bit of a caution. So if you are coming to UH and you're thinking about medical school or dental school or nursing or whatever, your initial focus really should be on academics and acclimating to university life. We have student ambassadors here from admissions, and I think they can tell you that the jump from high school to college is a big one. Whether you were an honor student getting straight A's in high school, it's going to be different when you're at UH. And so what I always tell students is don't come in thinking about medical school right away or dental school right away or pharmacy school right away. We'll get to that. What you really want to focus on in your first semester is, can I get as many A's in this semester as possible and be as happy as a college student as I can be and take advantage of what the University of Houston has to offer me? If you are pre-nursing, I could go on for hours and hours about pre-nursing at UH, but the bottom line is I actually encourage students who are considering going into nursing to contact the College of Nursing directly. They have their own advisors. And I really think that hearing it from the source rather than working with our office is the best way to go. Of course, we can help you if you're pre-nursing. We at least can get you started. But if you are thinking about doing nursing at UH, I would encourage you to contact nursing@uh.edu to set up an appointment or to ask any specific questions. What should you major in? This is a big question that I get from students coming in who are thinking about healthcare careers. The ultimate thing is that major is important in the sense that you want to be happy with the classes that you're taking, but they're not necessarily important for admission into medical school or dental school or optometry school or PA school. These admissions committees really don't care what your major is. There is no best major for a pre-med or pre-dent. And importantly, pre-med, pre-dent, pre-pharm, pre-PA, those aren't majors at UH. So you still will need to declare a traditional major. Biology and other science majors are more practical, but they're not necessarily the best. I encourage all students to ask themselves what they're interested in and choose a major that you're interested in, not what you think medical schools or admissions committees want to see. You can go to medical school and be a dance major. You absolutely can. You'll just have to sprinkle in some sciences in that degree program. So don't think when you come to UH, oh, I'm pre-med or I'm pre-dental, I have to be a biology major. That's not true at all. We had 17 different majors apply and get into medical school from the University of Houston last year. And so really it comes down to what are you the most interested in? What are the classes you're most excited to take? It doesn't have to be science. There's also no definitive checklist to be a competitive student for admission into these healthcare programs. You can do honors or not. You could declare a minor or not. It's all fine. It's about pursuing what you're interested in, okay? Schools don't want robots. They want students who came to UH and took advantage of as many opportunities as possible based off of what they were passionate about, not what they thought admissions committees wanted to do and check the list. What they do recommend is taking a full load, challenging yourself. Try to take more than 12 credit hours a semester when you get here at UH. That means usually 4 classes or so, 4 to 5 classes a semester. And again, pursue the classes and opportunities that interest you the most, not what you think looks the best on a transcript or a resume. And again, we can help you with this, try to game plan, figure out what you should do. But these are some initial points that I want to make clear as you're thinking about coming to college or coming to the University of Houston. Again, if you're pre-nursing, pre-nursing is a little different at UH. It is an application major, meaning that when you apply to the University of Houston, you have to put that you want to be pre-nursing as your first choice major. And you may not get into it. But if you don't get into UH as a pre-nursing major officially, you can still apply to the nursing school after your sophomore year, okay? So again, you don't have to be a pre-nursing major to eventually get into the nursing program and get a BSN from the University of Houston. More than likely, what will happen is if you're not selected for the pre-nursing major, you'll be put into exploratory studies, which is basically a non-major while you figure out what major you really want. What I say is don't stay in exploratory studies indefinitely. So if you're thinking about nursing and you're not in the pre-nursing major, these are some of the alternatives that I really recommend. Nutrition sciences is probably my number one. Human development and family studies, health, psychology, and exercise science. All of those majors are really great because they overlap quite a bit with the courses you need to apply to the nursing program at UH, but also other schools. And again, if you have specific questions about your situation, I always say contact the College of Nursing directly. Their email is nursing@uh.edu. So what should you focus on? I know I keep beating this drum, but it's really, really, really important. I find that way too many students come in and they overlook the 4 years of college they have in front of you because they're thinking too much about medical school, dental school, or whatever after they get done with college. I really, as a new student, want you to focus on exploring majors, minors, classes that interest you, not just what you think a checklist, interest you. Acclimate to college, get used to what the schedule's like, the rigor of the classes, and focus on performing well in your first year. If you don't do well in your first year, you're going to have a big hole that you have to climb out of to be competitive for whatever healthcare program you're doing later down the line. So really, classes should be the primary focus. And again, as a part of acclimating, look at student organizations, meet some peers, join some clubs, meet friends, and really try to integrate yourself with the student body at the University of Houston. And again, don't worry about the application process. If you're a freshman, there's no reason you need to be stressing about applying to these health professional schools. That's junior, senior year type of hurdles that you would need to clear. As a freshman, just focus on classes and getting used to being a college student. So here are the take-home messages. I told y'all it was going to be short and sweet. Again, our office works with all University of Houston students interested in healthcare careers. So medical school, dental school, optometry, pharmacy, PA, physical therapy, occupational therapy, whatever it is. We offer appointments for current students. We offer printed and web resources, all available on our website right now. And we also have events and workshops throughout the year. And so if you have questions about, how to write a personal statement, we have workshops on that. As a freshman or incoming student, focus on starting strong academically rather than the application process. And again, follow your interests. The beauty of University of Houston is a big university, a lot of different majors, a lot of different professors, a lot of different kinds of students and clubs and activities and classes. Take advantage of that. Don't get pigeonholed in a rut and say, well, I'm pre-med, I have to do X, Y, and Z. It's just not true. Maybe it was true 20 years ago. Nowadays, it's not. Again, admissions committees are looking for well-rounded, interesting applicants, not robots. So keep that in mind. So again, feel free to reach out to us by email. If you do have any questions before y'all are on campus, definitely check out the website. Again, a lot of good information on there, www.uh.edu/pre-health. And then if you are thinking about the nursing program at UH, I fully recommend reaching out to Ms. Carly Peden at nursing@uh.edu. She's great and can really answer more specific questions about what they're looking for when they, admit pre-nursing students, or even when students will actually apply to the BSN program. So that's it. I'm happy to take any questions at this point and offer any insight that I can. Anything?
Okay. So we got a few questions in the chat.
Good deal.
One says, can you major in nursing and still do pre-med?
No. So if you were to do nursing, you would be on a specific nursing track that would have you taking classes that enable you to be a nurse. And unfortunately, those classes don't overlap with what you need for medical school. So in order to kind of work towards being a nurse with maybe working towards being a doctor later, you would likely have to graduate with the nursing degree and then come back and complete any of the medical school requirements, because they're not the same. And in fact, most of the nursing classes won't count towards your science GPA and grades for medical school. They're really picky about health classes counting towards the classes that they're looking for medical school. So that means dental hygienist type classes, nursing type classes. None of those will count towards what you need to apply to medical school. So I would say, if you're considering nursing or being a physician, being a doctor, I would shadow both of those professions, really dig in, figure out what the fields are like, and then make a decision at least by your sophomore, junior year. It's going to be really difficult to straddle both of those career paths for too long, because they diverge quite a bit with the classes you need to get in, as well as the type of tests you have to take to apply.
Mm-hmm. The next question, is pre-nursing the same as traditional BSN track?
So the traditional BSN is the nursing program. So once you're on campus, you apply to the traditional BSN after your sophomore year. That's the NURS major, the nursing major. So again, you won't get into the traditional BSN as a freshman. You have to take all of the pre-nursing courses first, and then apply to the nursing program, the traditional BSN, after your sophomore year, and then you'll finish it junior and senior year, and then graduate with your as a registered nurse with your BSN. The pre-nursing major is the major that has you take all of those pre-nursing classes to eventually apply to the nursing program. And just a word of caution, you can come in as a pre-nursing major, take all the classes you need to get into the nursing program, and then not get in because you didn't do that well, or there were other students that have higher grades, higher test scores than you. So it always needs to be something that you're working on, thinking, am I in the best position to apply to this nursing program? Am I getting the grades that I need? So just to summarize again, the traditional BSN is the Bachelor's of Science in Nursing that you would complete your junior and senior year as an actual nursing major. But to get into that, you have to take the pre-nursing requirements in your freshman and sophomore year, and then apply to the traditional BSN after your sophomore year. And the nursing BSN program is actually at UH Katy. So you would do your first 2 years here at UH main campus, and then you would complete the BSN program at UH Katy campus. If you don't get into the traditional, they also have what's called a second degree BSN. That means you come to UH, you take 4 years worth of classes for whatever major you choose. It could be biology, it could be nutrition sciences. And then once you graduate from UH, you apply to the nursing program to get a second bachelor's, but the bachelor's in nursing. That's the option that I always tell students who aren't competitive and may not qualify for the traditional BSN are transfer students who are coming from Houston Community College or Lone Star and already have 2 years, or you were pre-med, you were going to go to medical school, but now you're thinking about a different career. The second degree BSN is the way to go. And that is a 2-year program at UH Sugar Land. Hopefully that answers the question. I tell you the nursing stuff's complicated, but once you figure it out, it's not that bad.
Someone asked, when do you declare your minor? Like, is there like a particular time that's recommended?
You don't have to have a minor. Minors aren't required unless your major specifically requires it. So you could technically never declare your minor. But if you wanted a minor, you could do it your first semester or you could do it your senior year. It just depends on whenever you want to declare a minor. If your major requires that you have a minor, and I know some majors do, then you would declare it by usually your sophomore year, and you'll work with your major advisor to discuss those details. But generally speaking, you don't have to have a minor for most majors. And so if you decide you want one, you declare it whenever you decide that you actually want one.
This question, how about pharmacy? Would those courses work? Like pharmacy courses?
For what?
I think maybe they're talking about like pre-med.
To some extent, there's more overlap in the medical school requirements with pharmacy than there is nursing, but I still caution anyone who's trying to ride 2 different career paths, because admissions committees can sniff that out. They're going to look at the shadowing you've done, the volunteer activities you've done, and they're going to say, well, it's clear that you're not really committed to pharmacy or you're not really committed to medical school. So why would we accept you? But if you're looking to go pre-pharm and then for whatever reason you decide you don't want to go to pharmacy school or you don't get in, there will be some overlap in the requirements for medical school with pharmacy more so than nursing. But again, I really caution anybody who wants to go 2 different paths for too long. That's something you want to figure out early on, because pharmacy requires the PCAT. That's a separate test. Medical school requires the MCAT. That's a separate test. Why would you want to pay and take 2 different, very difficult exams? Pharmacy is going to require certain classes that medical school doesn't, and medical school is going to require certain classes that pharmacy doesn't. So now you're taking a whole bunch of extra classes. So usually by your sophomore year, you'll want to have kind of figured out, okay, I'm more pre-pharm than I am pre-med or vice versa. And to be clear, pharmacy is a little different. You can actually apply to the pharmacy school after your sophomore year. You only need 60 credit hours of the pre-pharm requirements to apply. I don't recommend that. I recommend graduating first before you start pharmacy school. And that's because if you don't like pharmacy, you don't have to go back to college to finish your degree. You've already finished it. But it's about 50% students go to pharmacy school with their bachelor's completed, and about 50% that go to pharmacy school that have only completed the first 2 years of college.
That was actually all the questions that we had.
Okay.
I guess I can also ask a question because I'm kind of curious about this. Sure. So what's more kind of important in your opinion? Like if someone's trying to go to medical school, is it more important to have the best grades possible, or is it more important to have your personal statement and a great resume, research hours?
It's really all of that. And I know that's scary, but medical schools, they do look at numbers. They want to know that you can handle what they're going to throw at you in medical school, but they also want to make sure that you have the skills that they feel comfortable with sending you in a hospital and working with strangers that need help, right? That's what doctors do. You can have a 4.0, get straight A's, but you have no people skills. So when it comes to applying to some of these healthcare programs, whether it's medical school, dentistry, or anything, it comes down to, can you do the work? And you don't have to have straight A's. You absolutely do not have to have straight A's to get into these programs, but you want to be generally A's and B's. They want to know, can you do the work? But then they also want to know, can we trust you? Can we put a white coat on you with our medical school in the pocket, send you into the hospital and say, work with these patients, and they're not going to be worried about how you come off or how you interact. And so it really is about not just doing the work in the classroom, but also showing that you have people skills, teamwork skills, leadership skills by getting involved in student organizations, volunteering, whether it's at a hospital or your church or some other organization. They want to see well-rounded folks. But that's an evolving process. That's what I meant when I say don't focus on everything all at once as a freshman. Freshman year, worry about grades, because you want to get that GPA up to where you really feel comfortable. Then you can sprinkle some outside activities starting your second semester freshman year or sophomore year. You don't want to go into freshman year and say, well, I need to volunteer and I need to do research and I need to do this and this, because then your grades are going to slip. So start off worrying more about grades, then build in the extra stuff once you feel comfortable being a college student, whether it's joining student organizations or starting to look for volunteer activities at Houston Methodist or MD Anderson, or shadowing specific healthcare professionals, whatever it is. That stuff can come maybe a year and a half down the line.
Mm-hmm. And then someone in the chat asked, how can we get the recommended skill set that hospitals look for during this time, like COVID?
Well, it depends on what skill set you're talking about. I would say for student organizations, they're up and running. All the student organizations I work with are doing virtual meetings. And so if you were an officer in a student organization, whether you're on campus or off campus, you're still showing leadership activity and teamwork because you're planning these meetings, you're planning activities for your members. In terms of clinical skills, you're not going to get a lot of that during COVID, but there are opportunities to virtually shadow. And so I have a lot of students who are doing that, where they're getting, insight into the profession, what the day-to-day life is like for these healthcare professionals. They're just not there in person. It's virtual. And then I also recommend what's called informational interviews. And we do have information on virtual shadowing informational interviews on our website. But an informational interview is basically what it sounds like. You're interviewing a doctor or a dentist or a nurse or a PA about their career, about their path. And it can be done virtually. And so when you're talking about, when you apply to a medical school and they say, why do you want to be a doctor? If you've never talked to a doctor or really thought deeply about why you want to go that path, they're going to know, okay, you're not that committed. But if you speak to these physicians and you ask them, what's the worst part of your job? What's the best part of your job? What path did you take? What do you recommend for me? What's your day-to-day life like? Where do you want to be in 5 years in terms of your professional career? That's all very good information that you can use to kind of figure out, okay, this is what I want to do. And you can explain that in an application later down the line.
Mm-hmm. And then there's only maybe more questions. So last question from me, why the University of Houston? Why is Houston or the University of Houston a great place for, pre-health, pre-med, any of those?
Yeah, there's a few reasons. One is, as I've already said, there's a wealth of activities and opportunities, right? So there's a lot of different majors. There's a lot of different student organizations. There's a lot of ways to come and really find your people and the stuff that you like. At smaller schools, there may be fewer options. And so you get kind of pegged into these routes that don't really fit you. And so at a university like UH, you have a lot of opportunity to really find what makes you tick. But specifically about healthcare, UH has a medical school. UH has a pharmacy school. UH has an optometry school. UH has a nursing program. That's incredible. I came from the University of Georgia. I was the director of their pre-health program before I got to UH. UGA is the University of Texas of Georgia. It's the main school in Georgia. They didn't have a nursing school. They didn't have a medical school. UH is a quote unquote smaller institution in the state of Texas, but they have all of these different types of programs. And I just think that's incredible. And then the other part of it is being in Houston enables you to really go out and be in the community and volunteer with any type of population, that you want. And then in terms of hospitals, the Texas Medical Center is the biggest medical center in the world. So there's so many hospitals and clinics here that outside of COVID, you'd really be hard pressed not to find some type of volunteering, shadowing, or working opportunity to get some of that clinical experience. And so UH is really in a sweet spot, both with the programs that they offer specifically at the university, but also the network of opportunities just within the city of Houston itself.
Mm-hmm. And then we have, I think, one last question. What percentage of students get into a pharmacy school and the optometry school?
So we have that information on our website. I don't know it right off the top of my head. Here's what I'm going to tell you about admission statistics. Don't pay any attention to them. Because what I can tell you, I could fiddle with any day of the week, right? So I could sit here and say, this many people applied to pharmacy or optometry school from UH. This is the number that got in, and I'll have a number. And that number is probably going to be in the 40 to 50% range. Another school could say, well, our number is 80%. But what they've done is they'll say, well, this is the people who applied with at least a 3.7 and this score on the OAT or the PCAT. So they've now whittled the population that they're computing that number with. And so admission statistics aren't really that useful. You come to UH, you do well, you work with our office and you take advantage of the opportunities UH has, you will become a competitive student, and it becomes less about, what is it, 40% or is it 50% or is it 30%? It just, admission statistics, I just don't find that useful. But if you want to look at some numbers, it's on our website. The pharmacy page has pharmacy data, and the optometry page has optometry data.
Sorry, I like read it wrong.
You're thinking about a freshman.
Yay.
There's no reason to worry about admission statistics, so don't fool with that.
Mm-hmm.
What's that?
So that looks like all the questions we have. Do we have any other questions before we head out? We do have a few minutes left.
And again, if any of y'all have questions after today, there's our email. Either myself or my advisors will get back to you within a couple of days. And like I said, always check the website first, because we've likely answered some of your questions on there. But again, more than happy to try to answer anything that you have questions about through the email. And then once you're on campus, obviously we can schedule a more formal appointment for your specific path.
Mm-hmm. Okay, looks like we have no more questions. Thank you guys so much for joining us.
Thank y'all
for Cooper Preview.
Yeah, consider University of Houston. It's a good place to be. And I will say that I've really respected the decisions they made with COVID. They've been a lot more responsible than a lot of other universities. Mm-hmm. You're in good hands. All right, have a good one.
Okay, bye everyone.